All right. Hello, Dr. Madeline here at Forward Spine Center, and today I'm honored to introduce Dr. Mel Hardy from Juna Pediatrics. Dr. Mel has a warm, approachable personality and is passionate about providing personalized care to every family and child she serves. She believes in truly getting to know her families, meeting them where they're at, and creating just a supportive environment that helps kids thrive. Yeah. You were raised in Minnesota. Dr. Mel completed her undergrad degree from St. Ben's Medical School and pediatric residency from the U of M. After beginning her career in general pediatrics, she discovered her passion for newborn care and lactation. Yeah. That led her to team up with Dr. Michelle Haggerty and founded Juna Pediatrics, a practice dedicated to providing thoughtful, family-centered care to families and children. As a mother of 3 children and 1 angel baby, Dr. Mel understands the ups and downs of parenting firsthand. She is especially passionate about smashing the pervasive mom guilt and reminding parents that they are doing their best, one family at a time. Yeah. So join me in welcoming Dr. Mel Hardy. So Dr. Hardy, can you just start by sharing a little bit about yourself and what inspired you to become a pediatrician?
Sure. Well, thanks so much for having me here.
Fine.
I'm glad to be here. Mel Hardy, go by Dr. Mel, Dr. Hardy, Mel, whatever. So one of the reasons that I'm in pediatrics is because of my 4 younger cousins. When I was growing up with them, I learned like everything about peds. I feel like that is like at the core of pediatrics. I saw them when they were newborns. I saw them when they had to be, put to sleep, rocked to sleep, breastfeeding. I saw them during toddlerhood, their teenage years, like transitioning to adulthood. I got to see all of that like very firsthand with my younger cousins, and I just loved, playing with them, being silly with them. And I really got to love working with kids from a very young age. So I give them all the credit for me liking playing with kids. Of course, as a doctor, I like science, I like helping people. And my mom was a nurse. She was a single mom. She's a superhero. She brought me to a lot of like medical educational events through her work. And so also from a young age, I was like in the medical community. So when I was about 15, she set me up with one of her friends who was a general pediatrician. I shadowed her and like immediately knew that that's what I wanted to do. Dr. Rutherford is still my mentor and a dear friend to me today. And yeah, even throughout medical school and residency, I just kept coming back to peds and primary care peds, and that's just always where my heart's been at.
That's cool.
Yeah.
Oh, I know you're here. Yeah. So for parents who may not have heard of it before, what is direct primary care model and how is it different from the traditional pediatric office?
Yeah, so direct primary care is very different from the traditional pediatric office. So some of the main things are, right in the name, direct. You have direct access to me. You can call me, text me, anytime, actually. If you're having an emergency, I want to know about it. Call 911 first and then tell me like, hey, we're on the way. And I will probably meet you there because like I care so much about my families. So direct access to me, usually same day or next day appointments, which is just totally different from like waiting weeks to months to see a provider a lot of the times. Another difference is that I know my family so personally. A lot of the times it's like, oh, hey, how was that like dance competition that you did the other day? Like, I want to know about it. And my patients will text me a video of the first time their kid walked. And just like, it's so personal, both ways. We know each other so well. Another thing is that instead of the quick 10 to 20 minute visit times that a lot of time we see in clinic, I usually spend an hour, sometimes more, with my patients. If they have something small that it's like, okay, I'll come over and we'll figure out this constipation issue. Sometimes it'll be shorter. That's fine. Another thing is if there are problems, they know that they can get a hold of me. They know that they can have a visit with me if they need it. But sometimes we can even figure it out just through text. So we'll just go back and forth and figure out, what's the plan, and then I'll check back in with them the next day if we have something going forward, and then we can figure it out together.
And just prevents parents from spiraling.
Yeah, exactly. Yeah. I mean, the constant phone tree, nurse triage, scheduling, MyChart messaging. Oh my gosh, how do you even get a hold of your pediatrician? So
Right.
direct access is a big part of it. Another large difference is the payment model. So typically insurance-based clinics, you sometimes don't know upfront what it's going to be, or you have to pay copays every time, or like urgent care visits are astronomical. But with the low monthly membership fee, you get all of your primary care through me. So the direct access, all the text messaging that you need, the well child visits, urgent care visits if we need those. Of course, people still need to have insurance for things like labs, prescriptions, if they need to see specialists, and for the rare occasion that they might need emergency care. But otherwise, all their primary care needs are taken care of through the membership.
Sounds like a win-win. Yeah. So what motivated you to adopt the direct primary care membership model for Juna, and how has it changed the way you deliver care to children and families? You kind of just explained that.
Yeah. It's twofold though. It's better for me and my family, and it's better for my patients. I was so burned out of the traditional insurance-based model, and I knew my patients weren't getting good care in that short amount of time. So I really wanted to change that. I wasn't as present as I wanted to be for my own family, so this allows for flexible scheduling for both me and my patients. And it gives me and my families the personal connections that we all crave, the support systems that we need, and honestly, just the care that we deserve.
That's cool. Yeah, and you're passionate about it. Yeah. So what are some of the biggest benefits families notice when they join Juna?
Yeah. I'd say that a lot of families are like, are you serious? Like, this seems too good to be true
Yeah.
when they sign up. But it's not. Like, my families know that they can get a hold of me when they need to, when they have a question. And that can, like you said, it puts their mind at ease. They often have less urgent care visits, better health, and more freedom to do what they need to do for their child and their family.
Less Saturdays spent in the ER.
Yeah.
Or late nights.
I don't want that.
Yeah.
I've been there too.
Take that away.
Yeah.
So as a child health evolves from like mental health and preventative care to telemedicine and new technologies, how do you envision Juna Pediatrics growing in the next like 5 to 10 years?
Yeah, well, there's a lot of new stuff on the horizon that I'm excited about. So one of the newer things is called an eczema package. So I've had a lot of experience with treating eczema. And I have also seen a lot of kids who are not treated well, or that are just waiting for months at a time to get a visit. And I don't think that any family should have to wait to get their uncomfortable, itchy kid, the care that they need. So for initial evaluation, follow-ups, recommended labs, prescriptions, individualized treatment plan, all of that's within that package. And that's actually outside of the monthly membership. So if people just need help with their eczema but want to stick with their regular pediatrician, they can do that too. So that's one of the things that I'm playing with, is being able to see patients when they need to be seen. But if they want to keep seeing me for the membership, also awesome. So I want to be there for families when they need me. Another fun thing is that I'm going to be doing some conferences soon. So I'm going to go to a pediatric hypnosis conference and then learn a little bit more about pediatric integrative medicine. So I really want to take that holistic kind of like whole body approach and learn more tools that I can help keep kids healthy and really give them the preventative care that they need.
And what age do you treat? So like you accept all pediatrics, or when do you start seeing them?
Yeah, so Dr. Haggerty and I see kiddos who are kind of in that newborn range with fourth trimester doc. So we do kind of all the lactation and those intensive newborn visits that are both mom and baby care through fourth trimester doc. So fourth trimester doc and then Juna Pediatrics are kind of two branches of the same thing. So a lot of our fourth trimester doc patients, if they want to continue care, they kind of transition at that 2-month mark to Juna Pediatrics. So usually starting around 2 months, or if kiddos are a little bit older and want to join, that's totally fine too. But basically 2 months through 18 years, I can be caring for any of those kiddos.
I'm excited to hear
Yeah.
about the hypno
Yeah.
baby. Yeah. And
Yeah.
how you even bring that into pediatrics.
Mm-hmm.
And
Yeah, so people might have heard of like hypnobirthing.
Right.
So that's something that people use to like kind of get in the zone while they're in labor and delivery. But hypnosis in general has been used to treat a lot of different things. But I'm excited to learn more and, like I said, have another tool in my toolbox to help kids.
And that's all, just having all the tools. So, and finally, if a parent could walk away from one piece of advice from you about raising healthy, resilient kids today, what would that be?
I can't say just one, I'm sorry. So I'm going to say 4 quick things. Go outside, put your phones down, dance and sing in your living room, and trust your gut because you're a good parent.
Oh, and that goes back to just smashing that mom guilt, and everyone's doing a great job.
Yeah.
Yep. You're watching this video. You're passionate about trying to find the best thing for you and your family.
Trying to do what's best for our kids.
Thank you. Thank you for sitting down, Dr. Hardy, and sharing your insight and giving us just a closer look at Juna and the direct primary care model. We just appreciate your passion and just helping families and kids.
Yeah, thank you so much
and
for having
if someone would like to get a hold of you, what's the best way that they can do that?
Yeah, go to my website, junapediatrics.com, and you can message me, book a meet and greet, call me. You can do any of those things, and I'd be happy to chat.